There's a conversation to be had.
Oh, that's hot. That's hot.
Welcome to another Conversation to be Had podcast. So today we got a really special one for you. Today's guest, he isn't just a doctor, an author, or a health expert. He's actually my good friend and somebody I respect deeply and someone I consider a brother. Dr. Odili is a physician who spent years on the front lines of urgent cares, and he sees firsthand how our healthcare system, our diets, and our politics collide in real people's lives. He's also an outspoken advocate on what people actually need from the system that often fails them. And now he's breaking down the biggest myths in modern nutrition with his new book, F Breakfast, where he calls out the food industry. He challenges everything we thought we knew about dieting and lays out a simple, powerful approach to better health through keto and intermittent fasting. So today we're going to get into all of it: the ACA, the shutdown, the state of healthcare, what urgent care doctors really see every day, how diet is being sabotaged by the industry, and his inspiration behind his new book. It's an honor to have him here. Please welcome my brother and my friend, Dr. Odili. How you doing, sir?
I'm good. Thank you. Thank you guys for having me. What's up,
Doc.
Charles?
Appreciate you. Hey, Doc. Hold on for 1 second before we get into it. I want to let everybody know I'm your host, Chalo. That's your host, Rashawn. This is the Conversation to be Had podcast. Thank you. Thank you for all the support that you've given us. We appreciate it. I was just letting Sean try out the hosting thing for a little bit. As you can see, you don't even know what podcast this is. The Conversation to be Had podcast.
I actually said
I'm
that.
your host. I'm your host,
that.
Chalo, and this is Rashawn.
I forgot that part.
All right, today the topic we're gonna get into, folks, is healthcare. With the recent shutdown, there was for absolutely nothing because nothing happened. So we continue as the status quo. So on January 1st, premiums are going to be going up. People are gonna they're going to feel it a little bit, with the rise in premiums from what I'm hearing. But we have you here, Doc, to try and, talk to us a little bit about it, help us understand it. I mean, you can't solve it for us, obviously, but help us understand the situation a little bit more. A lot of times when people talk about healthcare, I mean, we know it's messed up, but not a lot of us know why. So, if you want to start,
Sure. So I know from the patient perspective, they come in, they get care, they go home, they feel better, and then they may get a bill in the mail. Behind the scenes, now if you're going to a place that's owned by a physician, there's not going to be much middleman action. When we see patients, if we have to send them a bill, it's going to be somewhere between $50 and $250. That money, reflects the amount of time and effort we put into providing you care, as well as the fees required to pay rent, pay utilities, pay our employees, pay for supplies. It also covers fees that we pay like insurance. So we have to have insurance as a physician to protect against malpractice. And that's when someone files a lawsuit. So in America, there's, lawsuits for everything, but the risk of lawsuit is real because there are so many lawsuits and so many lawyers. So that's an extra cost that we have to face here in America that you might not see in some other countries.
Okay. So Charlo, you made a point where you said that, the government shut down and everything like that. And you said it was kind of for nothing. I kind of think that, if we were going to do a positive on that, I would say that the Democrats did cast a light on how these enhanced subsidies are about to go away with the ACA. I think that's pretty important because they were brought in during the COVID pandemic time. And when they were brought in, the ACA enrollment practically doubled, I believe. So what do you think might happen, Doc, at the beginning of January when these subsidies go away? I mean, what do you see, kind of happening as far as the health industry and patients?
Well, the subsidies help bring down the cost for patients who are on the marketplace or they get insurance through the ACA. and that's to, of course, make the monthly payments more affordable. What happens when those prices go up is that fewer people are going to be able to afford their health coverage. Now, it's very complicated in the sense that we want everyone to have insurance so that we can all share the cost in keeping everyone healthy. But when the price goes up and people have to decide between paying for their insurance premium and paying for their mortgage premium or paying for food on the table, it's the insurance that's going to get cut out. Now, healthy people who don't have medical issues are going to have a hard time understanding the value of paying so much money for health insurance, especially since we all know that in case of emergency, you can always go to the emergency room. When we have that security blanket there, the more healthy people that leave the health insurance marketplace, the fewer premiums there are, and that means there's less money overall to cover the payments for the care that's provided to the people who end up being the sickest. Now, it sounds like a very far off problem, but in real time, that ends up making the insurance companies less likely to continue offering insurance. It also reduces the amount of money that hospitals get paid in the long run. That means hospitals may not be able to stay open if they're not getting the same amount of insurance payments.
Okay, I didn't know that at all. I always thought like when I read about the ACA and everything like that, and even Obama said it himself, it wasn't like the end all. He kind of made it sound like, this is just the start. This is just the beginning, and this is something we should build off of. I did like a lot of the ideas in the ACA. I like the fact that, they take care of preventative care. That was free. I like the fact that, children could stay on their insurance longer with their parents. I thought that was important. Things like maternity and everything like that, I believe was free as well through the ACA. But going back to the first one, the preventative care, I thought that was huge because I felt like, if people are going to the doctor for free for preventative care, down the line, that's going to take care of bigger problems that might come, things like diabetes and everything like that. So I like the ACA, but I always hear a lot of things, a lot of bad about it coming from the other side where they said that their premiums went up and everything like that. And I'm assuming that's the healthy people that they're talking about where their premiums went up. But the ACA to me also kind of took care of like the junk insurance that people would get, where they would get insurance that really did nothing. So, I mean, what are your views on the ACA? Do you think that was a good thing in the beginning, or do you think it's something that's feasible down the line, or something that can still be built on, or do you think that maybe it should just be scrapped and started over with?
So when the Affordable Care Act principles were first made public so that people could sort of weigh in on if it was going to be good or bad, before all that, like you said, there were a lot of different types of insurance that people could buy. So you could buy insurance that was just for the emergency room. You could buy insurance that you thought was covering certain things, but they would carve out a lot of things. And before the ACA, insurance companies could consider pregnancy a pre-existing condition and eliminate you from the health coverage. They could cancel your coverage if you got pregnant. You could be disqualified from having your insurance if you got pregnant. So it was very difficult for people to move forward in life with insurance without knowing if they actually had something that was going to be there for them when they needed it. So the ACA was born out of those fears. Standardize all insurance so that everybody knows what they're getting and nobody gets surprised. And all the insurance companies have to provide these services. So when we talk about preventive care being free, like colonoscopies, mammographies, cancer screenings, they're actually paid for by the monthly premium. So it's not necessarily free, but you don't have to pay anything extra out of pocket when you go to get this service. So if you're paying your premiums every month, then you're going to get these things for your premium. Because before, if you paid a premium, you might feel like you weren't really getting anything for your money. You're paying money to this insurance company, and if you never get sick, you're never getting anything back. And people didn't like that either. So when people say their premiums went up and they weren't happy about it, they may not have been paying attention to these health prevention services that they were getting, an annual physical every year with labs, a mammogram if you were of age, a colonoscopy if you were of age, other cancer screening that's necessary. These are things that are designed to improve your life expectancy. And in my opinion, it was well worth the money that's paid from the premium. But I mean, I can see why people weren't happy with it. But in general, stabilizing the market so that everybody knows exactly what they're getting for their money was very good for the long run.
Okay,
All
that
right,
makes sense.
I got a question. So, like just to sum it all up, you think that Obamacare or the ACA was a good thing? I mean,
Yeah.
in like the overall, I'm not saying it was perfect, but you think it was a good thing.
Right. Yeah, of course, nothing's perfect. And it didn't get passed in the way that they first envisioned it. They envisioned that they would also have what's called a public option, a government funded insurance plan, fully covered or fully backed by the government. So people would still pay premiums, but it would not fall through an insurance company. So the issue that we face with healthcare system in America is that the insurance companies have their hands in everything. And the insurance companies aren't doctors. They're not looking to improve people's health. They're not looking to make the country healthy again. They're looking at the profit line. So their job is to collect as much money as possible and to pay out as little as possible so the insurance company can continue to make record profits. So as long as our insurance company decisions are all being run by profiteers, we're going to have outcomes that are designed by that. People are going to get less, they're going to pay more, and they're not going to be happy or healthy. The ACA worked toward fixing that as much as it could, but as you guys know, nothing goes through exactly as planned with politics.
And that kind of goes to what you were kind of saying, Charles, about the cost of insurance. I mean, because some of the cost is it because of the fact that you have such high medical insurance that you have to carry, and then some of it's probably a lot with these insurance companies, like you said, it's based on profit, so they're trying to pay out as little as possible, and make as much as they can. But what are some of the other reasons why healthcare is so expensive? So, like, real quick, like when I go to a doctor or I go to emergency room, like a Tylenol will be like $10, a Band-Aid will be like $3. Why does that happen when we do that?
Well, it happens because they can. It happens because there's no law that keeps them from marking up any particular percentage. So they can charge $100 a pill if they want to for something that costs 10 cents to make. There's no reason. There's no scientific reason why these things have to be marked up so high. It's all for profit. So you could go to an urgent care and have the flu, get a test, maybe get a steroid shot and a prescription. And the urgent care, that visit might cost $200. And in the emergency room, they could do the exact same thing, and they might charge you $12,000.
Right.
And they may not do a CAT scan, don't have to do a chest X-ray. If they do those things, they'll charge you more. But they can charge what they want, and it's because they're sort of in charge. No one else is overseeing the process to sort of regulate or normalize these prices and charges.
Urgent cares, to me, they changed the whole landscape. Before, back in the day, you either had your primary care physician or you had the emergency room. And then when urgent cares came in, they were kind of like in the middle. And they kind of changed the whole landscape to where, like you said, it's more affordable to go to the urgent care than an emergency room. You can get care there. Obviously, if they can't take care of you at the urgent care, they tell you to go to the emergency room. But I always felt like, urgent cares was such a great idea. What kind of got you into the urgent care business, Doc?
It was just that. And, I still practice emergency medicine. I still pull shifts every week in the ER because I love the variety and I love the excitement and I love helping people and seeing them feel better in real time. But when it came time to open up my own practice, I wanted to be able to do it in an affordable way. I wanted patients to be able to come and not worry about not being able to afford getting better. There's nothing worse than feeling sick and then on top of that being worried that you can't afford what you need to stay alive. And I just wanted to make sure that I was doing my part to help people get healthy without breaking the bank.
So you see. Oh, go ahead, Charlo. I'm sorry.
Dang.
I'm sorry.
Jesus Christ. Okay. I see from the back to the Obamacare thing. It was a let me put it to you like this. With the way that the financial and insurance system is set up in healthcare, I don't know that I've seen a better solution to it than Obamacare because of the pricing that you're dealing with. So to me, in layman's terms, what Obamacare basically was working people paid, a higher premium, and just took care of the people that couldn't pay. You know what I mean? So it's basically they're the people that aren't getting sick, but they still, pay insurance. They're taking your money and they're paying for people that are getting sick, but they don't have insurance. It was kind of a trade-off, but you have to have something of that measure with the cost of medical insurance.
I think what you're describing is kind of the way all insurance works. So for your car, at least here in Texas, we all have to have car insurance. So the money we pay, we're not getting anything for it, but it is paying for the people who have accidents. So even though I'm not having an accident,
correct,
the money I'm paying into the insurance company is eventually going to cover someone else's replacement or repair when they do have an accident. And healthcare is the same way. We're paying for it. We may not use it, at least in theory, but the money is going to pay for someone else's healthcare services. Now, the ACA changed that so that at least everybody would get some type of benefit for their premium. They would get an annual physical. They would get an annual visit, mammogram, cancer screenings. That's Pap smear or PSA, prostate cancer or colon cancer. These things are now included in your premium. So at least you're getting something for it. When you pay your car insurance every 6 months, every month, or every 12 months, you're not getting anything back from that.
And see
somebody else's pocket with no benefit to you.
What I don't understand about it is like the vitriol towards the Obamacare. Like it's just it destroyed the country. And when people really look at it, you're not really that selfish, but you just, you're letting the politics get to you. Because if anybody came up to me and said, man, if you could give me $5 a week out your check and it would save my life, I would do it. And I'm sure most people would. And that's basically what you're doing. You know what I mean? So it's like you have to look at it in context of what it is. Like I said, if you're going to address the problem, you have to address those finances first. But until you do that, the only way for people to survive and, in this medical system, the way we have it set up, is for you to take from the healthy and the working and give to the unhealthy and the unworking. That's just the way we got to do it. I understand how people, are pissed about that, but I mean, you can't, like I said, you can't just let people die.
I think a lot of the anger just came from the fact that it was simply Obama who enacted it. You know what I mean? And the thing that gets me, which is ironic, is a lot of the ACA is based off a Republican plan. What the Romney Care. Romney Care is based off of a Republican plan, and so that tells you right there that the main reason they didn't like it was because it came from Obama. Who was it? Mitch McConnell that said that day one when they get in there, the first thing they're going to do is make sure that nothing Obama could do can pass or something like that. They didn't. Yeah. And even right now, they don't have a plan. Right now, they're about to strip the ACA of all these enhanced subsidies with no plan. It's just that people are going to be out there with no insurance, and it's crazy to me. They never gave it a chance. The minute ACA came out, they started chipping away at it, and chipping away at it until now. We're at right now. They wanted it to fail, and they've been working on it they've been working on it day and night for it to fail. Never gave it a chance. So, it was because it was Obama, man. It was never the end all to be all. It was always supposed to be the starting spot. Obama said it himself. This is where we start. This is the foundation to get people health care. And it's a shame what's happened to it, because I really do like ACA, the Obamacare. So, but yeah, I'm off my soapbox, Charlo.
No, you good. You good.
He talks about me. Says I go into soliloquies. So I got to watch myself. But yeah, man. So day in, day out at the clinic, what are some of the things that you see as far as preventative medicine and things, like patients that you see? What are some of the things that you see coming in there that are the most preventative things that people should be looking out for? Or what would you tell patients that they should do on to make sure that they're okay and they're healthy on a daily basis or whatever? Some advice you would give.
What I see on a regular basis is I see, working mothers and fathers. I see families. I see people who care about themselves and care about their loved ones, who want to be healthy and happy. And I see, patients who are injured, ankle sprains, lacerations, a lot of people, slicing into their fingers in the kitchen, trying to cook. I see people who have headaches that are related to high blood pressure or dehydration. I see, upper respiratory infections like RSV and the flu and COVID. But in general, I see people, and it's my job to try to help people feel better. So when I advise patients about what they can do to get healthy, be healthy, stay healthy, I definitely recommend everyone take a multivitamin every day. I also recommend to take 1,000 milligrams of vitamin C on a daily basis, a little more if you're feeling sick. I definitely recommend everyone to drink 8 glasses of water. So that's like 64 ounces. That's 4 of the pint bottles of water, plus whatever else you need to stay hydrated if you exercise. I advise patients that they should really stop drinking their calories if they can, cut back until they can stop, because the human body did not evolve with the need to have liquid calories except during infancy and childhood. So adults don't need to be drinking any calories. But what I really see is people who are victim to the way companies and corporations have geared everything around this with our nutrition to be unhealthy. There's a lot of food that has sugar in it that doesn't need to have sugar in it. There's a lot of food that's processed that sort of removes the fiber from it, so it's less healthy than it was when God gave it to us. And there's a lot of marketing about food, about what we should be eating that is totally opposite from what our bodies need. So a growing child's needs are very different from a grown adult. When you look around you, you look at the people at work, at home, etc. Adults aren't getting taller anymore. If you're not getting any taller, you don't need 3 meals a day, except so a few medical conditions that do require round the clock nutrition. In general, people will be just fine limiting their dieting or limiting their eating to 2 meals a day and maybe a snack in between. When the body takes in more calories than it's using for energy purposes, those calories get stored around the belly and around the body as fat. And I see people struggling with that on a regular basis. And it's because they're not armed with the information that they need. It's not taught in school. Nutrition isn't taught the way it used to be. And frankly, the plans that they gave us, 25 years ago aren't going to work today because the food has been engineered to be more addictive, more sugary, and less healthy in general.
You talk about that in your book, and I thought that was really interesting. I mean, you go deep into the history of the breakfast and cereal companies, how they marketed breakfast in the beginning. You talk about the explosion of liquid calories. I thought that was really interesting, and it was some insight that I had never known before. One question I have is, how much of obesity today do you think is like a personal choice, or how much of it do you think is the food environment setting people up to fail? Like you were talking about.
So, it's complicated. The studies that we need are very complicated to even try to perform. When you talk about how addictive is a drug like cocaine or meth or heroin, we have the fMRI studies on the brain to show what parts are activated. And they've done similar studies like that when people are exposed to sugar, high fructose corn syrup, and other forms of sugar that are man-made, that are more sweet than natural sugar. And similar parts of the brain light up during those studies. So we know that there's a mechanism of possible addiction with the brain pathways that are activated with the high fructose corn syrup. So there's definitely an argument that you can make that people are addicted to these foods that they're eating and have a psychological dependence on them, making it very difficult for them to stop. How much of it is really hard to say, but the government's not helping us with a lot of the things that are done. They subsidize corn farmers and other, sugar producers. And it's funny that the government, parts of the people who are in our government are okay subsidizing oil and gas. They're okay subsidizing corn farmers. They're okay subsidizing polluters, but they're not okay subsidizing our healthcare. So the things that contribute to our poor health are getting subsidized with our tax dollars. But that same money that could be used to try to keep us healthy, they have a problem with that. So you should definitely, pay close attention to those details about who's getting subsidies and who isn't, because they want you to feel bad when certain people get subsidies, but they don't want you to know that other people are getting subsidies who are not paying taxes at all.
And that's crazy because, one of the biggest things that you hear people when they talk about SNAP is that they shouldn't be able to buy junk food or they shouldn't be able to buy this, they should only be allowed healthy food and everything like that. But I was explaining in one of our other podcasts with me and Charlo, when we were talking to some Trump supporters, and they were talking about that they should be able to buy pop and all that. And I was, explaining to them that it's not that simple. A lot of people live in like food deserts. They don't have grocery stores where they're at. All they have is the corner store and everything. So, going for the healthy option isn't always there. It's not available. Or you might have like a single mom that's raising 4 kids and she just got to put some dinner on the table real fast. So she just can't do it, So I found it interesting. That's interesting, that about the subsidies and everything, that they subsidize all that. It's kind of like the way it's set up kind of for people to fail in a way when it comes to looking for healthy options or eating healthier. Am I understanding correct? Or?
Yeah, if the government's telling you that you should have 3 meals a day and they're giving you pictures on what that food should be and they're talking about food pyramid and eat this and not that, but they're making it hard for you to get healthy food, easy to get sugary drinks and sugar-filled foods, the two don't add up. You can't get healthy by eating unhealthy food, and if you don't have access to the types of food that are going to help you be more healthy and you don't have access to the information that you need to make healthy choices, then it is a system that's set up to fail.
Doc, go back to the drinking calories. So are you saying that that's not good for you? Is that
I am. Go ahead and let me let you finish. I didn't mean to cut you off, bro.
No, I mean, because when you work out, you have a smoothie to get so much, like I need a certain amount of grams of protein. So I'm gonna have the smoothie here. I'm gonna eat, but I mean, the smoothie gives me the added protein that I need for the, what I'm trying to accomplish, physically. So that's not good for you is what you're saying. I mean, I don't know. I'm just asking it.
No, it's a fair question. It's a fair question. So,
because that's very popular in the workout world. You got to have your protein shake. I'm sure Rashawn know he be at the gym every day. You got to have your protein shake. You walking around without no shake, like what's going on? But
yeah, that's all marketing. It's all marketing. Okay. Nobody needs a protein shake. Whether you eat your protein or you drink your protein, your body's going to break down the protein or the meat into its base form, which is amino acids. So the way that you eat should be geared toward your goals. And like you were saying, they tell you that you need protein so you can achieve your goals. So if you were trying to build more muscle, bulk up, get larger, you would want to eat more protein because the amino acids in the protein is what allows your muscles to grow and expand. But you do not need to drink those calories. When a person drinks calories, in a sense, if they contain sugar, those sugars enter your bloodstream much faster. It bypasses the first couple phases of digestion. So initially, you're supposed to chew your food. There's a built-in delay there. The time it takes for you to chew your food sets off a cascade of neurotransmitters that transfer from your mouth to your brain, to your stomach, back to your brain. And that's what makes you salivate, and that's what gears up the stomach to sort of get ready for the meal that's coming. Then your stomach is supposed to digest the food, and there's more time consuming the food, allowing the time for those neurotransmitters to eventually reach your brain to let you know that you're full. When you drink something that's blended, you're bypassing those steps. So you actually overconsume calories before your brain can determine that you're full. So I actually always advise my patients to drink water with their meal so that it slows down the process a bit and allows your stomach to feel full without over consuming calories. But like I said, drinking them bypasses all that and defeats the purpose.
But if you're, let's say like you're trying to bulk, and I know I need a certain amount of protein for the day, like I know for a person like me, I'm not an eater. I don't eat for fun. I only eat when I'm hungry. Like, so the added protein that I need, I will have to eat it. And it was easier for me to do the protein shake and get my protein that way than to eat something like, some rice and chicken or something like that, a whole meal like that. I could go down the shake way easier than it would be for me to intake that many meals to achieve the same protein intake that I need for that day to bulk myself to where I needed to be. I mean, because I used to be into it real heavy. So I would sit there and be like, okay, I need this. And I would weigh my food and all that stuff. Like I used to be into it like that. But what I'm saying, like if you're not an eater, it's hard to get those extra meals and protein in your body, because like you kind of like your body ain't used to putting that food in. But it's easier like when you do the shake and you getting the same grams of protein and you're not eating a like meal. It's easier on my body, I'm saying. But like if you're saying that's not good,
that's totally valid. No, I think again, it should all be geared toward your goals. So the average patient I'm seeing isn't having the same issues that you're describing. Somebody who's not an eater is not the type of patient I'm seeing that's overweight, struggling to get to a healthy weight, someone who's obese. Those people are eating, 3 meals a day. For someone who doesn't eat 3 meals a day and prefers to drink and is not overweight, not obese, not morbidly obese, it's perfectly fine to consume your nutrition that way.
Okay. Well, go ahead.
I was going to say, for someone who's actively trying to lose weight, and that's another, unnecessary, complicated term. People talk about weight loss, but you don't want to lose muscle. You don't want to lose water. You don't want to lose bone. The only thing you want to lose is fat. So when patients talk about weight loss, I interpret that as meaning that they're trying to lose fat off their body. So for people, if that's their goal, then we want to modify the way you eat so that you can achieve that goal. For you, you're saying that you're trying to increase your mass, increase your muscle and protein consumption is the best way to do that. For people who have a different goal, they need a different plan.
Right. Now, like for our community, and I'm strictly talking about the Black community because that's the only one I have experience with eating. We use food as a celebration purpose. Like, that's why it's so hard for us to kind of shift into the whole healthy eat right thing, because we're so used through generations of customs using food as not like eating because we're hungry, is eating to celebrate this or celebrate that. And, I asked my dad about it one day, like, man, why do y'all always, and he told me that's just the way it is. And I think it's because of lack of economic, funds, that's what we use. Like we'll have dinner, like we can't get you a present, but we can celebrate by, having dinner together. And I think that tradition with our people is what's kind of contributing to the obesity right now. You know what I mean? Now that we want to get healthy, it's hard because genetically we've been engineered to eat like that. Like I consider myself abnormal because I only eat when I'm hungry. I don't get up and be like, okay, it's so-and-so o'clock, let me eat. I'll go through the day, and when I get hungry, I eat. That's just how it is for me. But I don't have a certain time that I eat, or it's just when I'm hungry. It's not a tradition with me. Eating isn't a tradition. It's just something that I do to survive, to live. I don't have fun with it. Like I don't find enjoyment in eating anything. You know what I mean? What
you're describing is definitely your body signaling you when to eat, which is perfectly fine. It's healthy that way. Prevents you from overeating. I think that the traditions that people celebrate I wouldn't necessarily blame the obesity epidemic within the African American community simply on traditions. I think first and foremost, the food that is available to us has been engineered to be less healthy. In some instances, the processed foods less healthy than natural foods, and more savory. Which again, the processed foods that are available to us are engineered to be more flavorful, more tasty, more addictive, so that if you have one chip, you end up eating the whole bag. If you have, buy a package of cookies, you want to eat the whole package of cookies because it's all scientifically tested to be as palatable as possible. When you combine that with limiting options due to market economics, like Rashawn said, not every neighborhood has a nice grocery store. Not every neighborhood has access to fresh vegetables and fruits on a regular basis. So people don't get the benefit of a variety of diet that other people do. So the traditions just play a small part. Celebrating with food is great in my opinion. I believe food should be celebrated. I believe people should enjoy what they eat. But I believe that people should also be armed with the education to choose how to eat to achieve their goals. Knowing what's within your food, how to read a nutrition label, how to pick out what's there, and knowing how your body metabolizes food are things that should be taught in school that are not taught in school. If you knew that you wanted to lose the fat around your belly, you should also know that your body is not going to do any of that through exercise alone. Exercise burns calories. Some people may think that exercise burns fat, but it doesn't. Exercise is a form of mechanical work. Whenever a machine does work, it requires fuel and energy. And the human body prefers sugar as its primary source of fuel. Anytime there's sugar within your body, it's going to be used by your body to perform work. Your heart beating, your lungs breathing, your legs walking, all that's going to run on sugar. It takes about 4 to 6 hours of continuous exercise to run through your body's sugar storage. And if you're eating every 4 to 6 hours and there's sugar in that, your body's always going to have sugar to run on. It's never going to touch that fat energy. You cannot burn the belly fat or any fat on your body unless you have run through all your sugar storage. And that is the main reason why, in general, America has become more overweight, more obese, and more unhealthy.
Hey, real quick, there was a great analogy you used about a vault and a bank. Could you share that here again? Because I love that.
So if you think about energy for your body like money in the bank, sugar in your bloodstream is like the ATM. If you need money fast, you go to the ATM and it comes out real fast, you're on your way. That's how your body works with sugar in the bloodstream and sugar stored in the liver. It's easy to put money in, it's easy to get money out. Fat storage around your belly is like a vault at the bank. You can't just get it whenever you want it. It's locked in. It takes some work to get to it. You can only do it during certain hours and certain conditions. You can't just go get money from the vault or your jewels or whatever you have in there. I don't know. I don't have anything in the vault, but I know you can't open it whenever you want.
Doc. Come on. Stop playing, man.
No, it's all good. But that's how your body locks away energy in the fat. It doesn't come out whenever you want. You can't force it out. Special conditions have to be met before you can access any of that energy to store it in fat. And that's what I try to educate patients about, that if your goal is to burn fat, you've got to unlock your body's fat burning metabolism. The only way to do that is to stop ingesting carbohydrates. So if you take just 30 days and you stop doing carbohydrates, you stop drinking your calories, and you limit your eating to 8 hours a day, your body's fat burning metabolism will unlock. It'll be unleashed and you'll be burning fat like you've never done before.
Now, does that apply? Because I mean, I hear what you're saying, and in theory that's correct. But like, does that apply to women? Because women have all kind of other different stuff going on that affects their weight loss. Like, I'm married, and You know, you got premenopause and hormone deficiency, and I mean, it's just all kind of stuff going on with them when they go through a change or something. Does that affect, you know, so they trying to lose weight, but it's not working? You know, she really ain't eating nothing, so I'm not understanding what's going on. So, I mean, does that have something to do with it that's different for like men that men would have to go through, or no? It's just, you know.
It can be different. So definitely if you're of childbearing age, you're trying to get pregnant, currently pregnant, you want to consult with your doctor before making changes like this. But even outside of pregnancy and breastfeeding, this is basic biochemistry. If your body doesn't have sugar, your body has to reach for that storage for energy and the fat. And it's going to convert that fat into energy to continue to run your body. The key is just avoiding the carbohydrates. So a woman who is trying to lose weight the old-fashioned way by eating less, every day, in general, that's a struggle. Most people don't enjoy that type of living.
Correct.
So if you're eating less than you want or need, it can be miserable. It's a slow form of starvation. It would be better or more enjoyable, in my opinion, and what I recommend to patients is to simply cut out carbohydrates and continue to eat in a normal fashion, healthier foods. Now, this doesn't mean you can't have any carbohydrates. There are a lot of foods that contain carbohydrates. They're still healthy for you because the carbs that are present are fiber. So if you eat foods like broccoli and celery, along with your beef, fish, pork, veal, shrimp, eggs, cheese, these types of foods combined will still meet all your nutritional needs without having to, get into the carbohydrates that would stop you from burning the fat.
And so that's the difference between when you were talking about net carbs and total carbs. Because I remember I was looking at the back of some Atkins meal bars, and the total carbs were like 20 grams, but then they put on the front of the box net carbs 3 grams. Are net carbs the only ones that you really need to worry about when you try to eliminate carbs? Because the other carbs are just the good ones that you're talking about that come through fiber and everything. Is that what that is?
Right. So if you are looking at the back of a label and you're trying to decipher that, the total carbs can be a bit confusing because it's going to contain the dietary fiber, and it's also going to contain sugar alcohols, which are special chemically made sugars that are actually made from alcohol and not carbohydrates. So the net carbs, that's the total carbs minus the fiber and the healthy carbohydrates. That'll give you the calculation for the net carbohydrates. As long as the serving size shows that it's 5 net carbs or less, then you can have a serving or 2 of that with the meal or with the snack, and it's still going to allow your body to maintain ketogenesis. Ketogenesis is the biochemical process where the body burns fat to create energy to continue to fuel your body's metabolism.
Now, does your book talk about this? You just came out with a book. Does it?
It is.
What's the name of it?
So it's called Forget About Breakfast. It's a big F on the front because breakfast gets an F in my book. I believe that when you look into how America was first pitched about breakfast, there were a lot of forces in the food production industry that were trying to get certain foods sold on our plates and in our homes. Now, again, I agree that children do need to eat 3 times a day to fuel their growth and continue to be healthy. But it's adults who have stopped their growing. And I say they stopped growing because they stopped growing taller. But if you look around, the people that are eating 3 meals and more a day, they're growing wider, but they're not growing taller. And that's because continuing to consume sugar on a regular basis, that body is going to take that extra sugar, convert it to fat, and store it, because that's how our bodies were, engineered over time. So within the book, you'll have information about the history of breakfast, how it came to be recommended and why we really don't need it, as well as detailed information about ketogenesis, how to burn fat by avoiding carbohydrates, and the medical benefits of that, as well as the type of foods that you should be eating to maintain that process and the types of foods that you should be avoiding.
Now, you said it's called Forget About Breakfast, right?
Yeah.
I like in the society we live in, a lot of people forget about breakfast anyway. Well, what would you consider breakfast? Would you consider breakfast eating between, let's say, the 5 a.m. to 10 a.m. slot, or would you consider that the first meal of the day to be breakfast?
So what I'm considering breakfast is the meal that's been marketed to us about how we should eat first thing in the
All right,
morning.
so getting up in the morning. Okay, yeah, okay.
Yeah, that's what's been marketed as how we should start our day. Whereas in other countries around the world, they start their day with a cup of tea or a cup of coffee and very little, nothing heavy. I think that medically, the patients, when I'm recommending them to reduce their intake, starting your day with a good meal around 12 and limiting yourself to an 8-hour window of eating provides you with a 16-hour period of fasting. The way that helps you medically is it gives you time to use the energy without having to give it more sugar. When you do eat, your body is going to prefer whatever has just been put into your body. But by giving yourself a 16-hour fast, you're able to unlock more of the stored energy. You're able to unlock more of the fat storage that needs to be burned. And that allows you to achieve your goal faster, getting rid of that fat off your body.
And it was crazy, Charles, because when I went to go visit, we went down to Houston to visit Dr. Odili. I was in his office and I was talking to him, and I don't know how we got on the subject, but I was talking about visceral fat and how I go to the gym every day and I can't get rid of this belly. He kind of smirked, right? And he was like, I got a book. I just started laughing. And so, what I wanted to ask you was, what inspired you to write this book? Why did you feel people, needed to hear this message? What inspired you, brother?
Man, everybody, I feel like every day I work, I encounter somebody who's struggling with this. And it's because it's so prevalent. And I really feel like what's marketed to us, it has been a disservice, and people really didn't have the tools they need to understand that they're keeping themselves from achieving their goals with the food choices that they're making. And it's the type of advice I've been given for the past 10 years, just combined into one package. I've always recommended patients avoid drinking their calories because I know that it's not, it's not biologically necessary. And then over the past few years, for certain patients, I've been recommending the keto diet. I think that the way that it's designed in my book and the way I recommend it is to do it for a time. So this is not meant to be a complete lifestyle change. When your goal is to burn fat, you would follow this plan. And I believe in 30 days, you're going to like the results that you see. And when you reach your goals, you don't need to follow this particular plan for the rest of your life. After 30 days and you've achieved your goals, I still recommend, limiting your eating with intermittent fasting to an 8-hour window. And I also, continue to recommend that you don't do any liquid calories. But you can go back to eating the types of foods that you were eating before you do this plan after you've achieved your goals.
Is the keto plan in the book?
It is.
Okay.
Full details on all components of it. The key to the turning on your body's sleeping fat burning metabolism is the combination of ketogenic diet, which is no carbohydrates, intermittent fasting, which means only eating for 8 hours a day, and avoiding liquid calories. So that means you focus in on water, teas that don't have sugar added, coffee that doesn't have sugar added. Coffee with cream is okay as long as it's not overloaded with cream and there's not overabundance of sugar in the cream. But these beverages that don't contain any calories are better for this particular plan because the sugar in those drinks will keep your body from metabolizing any fat because it's going to choose that sugar instead.
And so, Charlo, I actually followed the plan. I've actually been on it for, this is my week 4, to be honest with you. I went ahead and did an extra week. And, in the beginning, it was a little rough. Like I felt weak. I felt tired. It was almost like your body was going through like withdrawal. You know what I mean? But then now I don't have any of the cravings that I used to have before. And it was interesting because you're right. I go to the gym every day and I run. I run a 5K, 3 to 4 miles a day, and then go work out. But I wasn't losing any weight. And so it wasn't until I started doing this that I saw the pounds drop off. I even joked with Doc. I was like, I see half an ab, man. I got half an ab coming through, but I see definition now coming in my stomach, and it was really cool. I want to say though, the hardest part for me was drinking black coffee. I don't know how people do it, man. Getting up in the morning drinking coffee with no cream. That was rough.
That's part of the plan. Or you drink regular coffee, or you don't drink coffee. You had to drink black coffee.
No, I drink coffee, but I put a ton of cream in it. My coffee's like a Snickers bar. Okay, that's what my coffee used to taste like. The hardest part for me was waking up in the morning and getting a cup of black coffee. Oh my God, I don't know how people do it.
Oh yeah, because you got to cut the sugar out.
Yeah, you can't have the sugar. But I can't. The results is just crazy to me, man. Like it's just crazy because it took 3 weeks, and Doc, he was checking on me every day, and I'm pleased. I'm very pleased at the way I look. I got better confidence. My clothes fit better. When I sit in this chair, I don't feel my stomach pressed up against my jeans anymore.
You about to leave your wife?
What's that?
You about to leave your wife?
And I wanted to put a picture up, right? But she was like, "You can't be putting up no thirst traps." So I was like, "Okay."
Yeah.
I was like, "Okay."
Yeah.
Baby,
I mean, that's
breakfast,
awesome.
baby. Look at this. Have breakfast, baby. Look at this.
But I think this is how what I always wondered how people in Hollywood do that thing. You watch people in Hollywood and actors and stuff like that. Well, I mean, besides
it ain't nothing we're not talking about. It's straight steroids.
They do those diets. Like you see them do it all the time, man. And I think this is what those from this book is what you're. I'm telling you, from this book
ain't that much chicken and broccoli and rice in the world, man.
Believe me, man.
No. Anybody can do
4 weeks. No, not in 4 weeks though. I mean, like you seen them dudes, man. They turn into, rocks. From being pregnant on the beach to all of a sudden they got a 6-pack the next day. Like, wait a minute. Like, how did that happen? Like, what trainer did you use? The trainer with the needle? I'm just
that brings up something. What do you think about Ozempic and all that? I mean, what are some of the drawbacks?
Yeah.
I mean, is there anything like positive about it, or
know your opinion?
Definitely.
Myself.
So the first generation of the GLP-1s like Ozempic were very effective at helping people with diabetes improve their blood sugar. And one of the main effects was early fullness. So you would eat and then you would get full much faster. Mm-hmm. Getting full faster keeps you from overeating. So those patients were eating less, taking in less calories, and that allowed them to lower their blood sugar because they were having less sugar in their system. The newer generations work even better. You take them and you get full so fast that you end up eating sometimes only one meal a day. No matter how you slice it, if you're only eating one meal a day, you're going to lose weight. Now, whether or not you lose the weight in a healthy way just depends on exactly what you're eating. But for some people who are on the shots, you can see it in their face because they're losing weight faster than their body can manage. There are also some side effects like having some upset pancreas and having some abdominal pain, and some patients have vomiting. So not everybody who starts is going to be able to continue these medicines. In general, they can help you achieve your goals depending on what your goal is, but they're not for everyone, meaning they're not going to be a pleasant journey for everyone. And I continue to see patients who wanted to have fat loss as their goal, not just weight loss, but to lose the fat. And I think it's important that we talk about, patients not simply just weighing themselves every day and trying to micromanage their progress and seeing what they're doing every day, because that really isn't how this type of process should be monitored. You really want to be looking at your waistline and how many inches you're losing. So, Sean, you can tell them how many inches you lost in those 3 weeks around your waistline, so they get an idea for what type of change we're talking about. But the medicine has its effects that are positive when prescribed by a physician and part of a proper planning. But there are a lot of people who are getting the shots without talking to a doctor, and they're not going to be able to know if that's the best way for them to achieve their goal if they're not talking with a physician. The plan that I recommend is specifically for people who are trying to get the fat off their body in a way that doesn't involve any type of injections.
Hey, you brought up a good point because you told me this too. You said the scale is not your friend, and I was one of those people that would wake up every morning and hop on the scale. Why do you say that? Why do you say the scale is not your friend specifically?
If I go to the grocery store and then I show you, tell you how much I spent, telling you how much I spent at the grocery store is just a total number. It doesn't tell you what I bought. It doesn't tell you how much fruits and vegetables I bought or how much junk food I bought. It doesn't tell you what's in my cart. It's just a number. And the number on the scale is the same way. It's a total number. It doesn't tell you how much fat you have, how much muscle you have, how much water weight you have. So that number alone isn't something that you should look at on a daily basis to make decisions about how things are going.
Especially the littlest dude in the world hopping on the scale every day, talking about trying to see how much weight he lost. It sounds crazy to me right now.
Told him to stop, man. Told him to stop.
Talking about, yeah, man, I'm losing some weight.
Matter.
Man, first of all, his waist was already a 29, boy 16 or something like that. He just drank beer. He just drank beer and had a belly. But, I mean, the waist part, I mean, he already had a little boy waist. I mean, come on, man. I mean, you talking like my 600-pound partner or something. Like, what are we talking about?
But that's the beauty of the plan, man. If you can get the belly fat gone on a guy that wouldn't
don't use him in no commercials for your book, man. I mean, he's already little, dude. Come on, man. His before and after is not going to be impressive, bro, I promise.
It was the belly fat, Charles. I was one of those dudes that had a six-pack for no reason in high school. Like, no reason. Didn't work out, didn't play sports or anything like that.
Because you was little.
I know, but then I got, I'm older now. And I got this belly around me. I didn't like that, man. You know what I mean?
5'2" dudes do not walk around, you know what I'm saying, with pot bellies as a kid, bro. I mean, they just don't. Like, yeah, you were a buck five, you know what I'm saying? 5'2". Yeah, you wasn't gonna have you was gonna have a real six pack, man, because you was almost down to the bone.
Oh, Charlo ain't gonna take this abuse, man. Ain't gonna take this abuse, Charlo.
You didn't start even getting thick till you started drinking beer.
Yeah.
Am I right? Yeah.
I cut that out though. That was another thing when you talk about that.
He was a beer connoisseur. He wasn't just a beer jerk. He was a connoisseur. Like, he had to have a cup. This cup has to have. You can only drink in this cup, Lagerman's or whatever he used to. Oh no, I don't drink that anymore. I drink this. You had to have this cup. I mean, come on, man. He got bougie with the beer and everything, dude. But yeah, beer got him big. Beer got him big, just like the winos you see on the street. They be super skinny because they don't eat, but they belly look like they pregnant. It be that.
That's
beer,
the effect
man.
of drinking calories. That right there. Now, it's totally okay to enjoy a beverage from time to time. It's something that should be enjoyed on occasion. But the daily habit of drinking your calories will lead to the body storing those calories around the belly. That's a direct effect.
Yeah, but I mean, like, I watched him get like the weight that he is. I watched him get there because when he wasn't a beer drinker. He got in college and started drinking beer, and then they let him bartend for some stupid reason. It really got dumb. Like I said, he got bougie. Oh no, I don't drink that beer anymore. I drink this. This is the cup you use. See, it's got the name on it right there. Man, get out of here, dude. You better pass that Bud Ice, man. Let's get rid.
I have my time. You know what I mean? I don't drink beer no more. I don't even like the taste of it anymore, man.
Really?
No, I don't drink beer anymore. I don't drink at all, actually. Really. I don't really drink. I can't. I got a 5-year-old, man. He still want breakfast in the morning. Okay, I can't tell him daddy got a headache or anything like that. He ain't trying to hear that.
The doc said F breakfast.
So he want breakfast. Doc also said kids.
That's for adults, man. Adults only. Adults only.
Man, I'll roll over and be like, hey, boy, the doc said F breakfast. Go on back to bed, son. You got some extra minutes.
Hey, I do have another question for you, man. After the 21-day plan is over, right? What do you suggest people do not to regain the weight? Like, I know not to not to drink calories and stuff like that, but what are some other tips would you say people should do so that they don't regain that weight that they just lost?
Yeah, I think that the main thing, like you said, is to not drink those calories, but it really is to stick to a life free of breakfast. It's to do that intermittent fasting where you just start your meals in the middle of the day. You have a lunch, a late lunch, whatever time works for your body, and then to have a second meal before bed. And going to a 2 meal a day plan with some snacks in between is really going to keep you from overeating. Still make sure your body is burning up fuel during that 16-hour fast, and that's going to prevent accumulation of that energy around the belly.
I'm not gonna lie, Doc. I loved it when you told me I didn't have to go to the gym. It was kind of nice being at home. You were like, just gonna burn fat. You don't need to go to the gym today. And he was right, man. Like it was amazing. I would go to the gym and spend like 2 hours there and get no results. So it was crazy.
I mean, you got a stronger heart. Physical exercise is good for building muscle and strengthening your heart. So it's still recommended.
Oh,
But
absolutely.
people should understand that physical exercise is not going to burn fat. That's not how the body is designed.
Yeah.
He just don't, he gonna be the grandpa. He gonna be the grandpa at August's games and stuff. So, he don't he don't want to have to carry around that oxygen thing. So he want to be able to breathe real air. That's why he doing all this, Doc. He waited till he was 100 to have another kid. He got a little one. He running around like.
But you ain't lying, man. I got to be able to keep up, right? Like I got to be able to keep up, man. I got a 5-year-old now, so I can't let myself go. I got to be able to keep up with this little man, So, it's very important for me to be healthy. I ain't gonna lie.
Supposed to be going to college graduation ceremonies, man. He going to kindergarten graduation ceremony. I don't know what he think he gonna turn back time. Father Time he don't play, man.
You can slow it down though. That's what I'm trying to do, is slow it down a little.
Yeah, I can't wait till he playing ball in the yard and he can't see the ball coming because he's so old, and it damn near knock him out.
Oh, but I can't stand you, man. I can't stand
I'm just telling you. I realized that I was old playing ball with my son. Like, hey, man, that hurt. Like, you might have to play with people your own age because like playing with dad is not, it's hurting daddy. You know what I'm saying? Like, we get to that age, man, and you got a young one, you got to run around. He gonna be faster than you at everything. You want to go punish him, you got to give him a whooping when he come back because you ain't like you're gonna run and catch him.
Oh man, I don't with my kids, man.
I need. I'm just thinking about grandma. Like grandma will grab you up, man, and whoo. You live in a new age. That's a whole new podcast.
Hey, if you could leave people with one sentence or one thing that you think is important about your book, what would you leave them with, Doc?
I would tell people that you can achieve all your goals. There are people that come across that feel like they're about to give up, that they feel like they've tried everything and they feel like nothing works, but they've never been educated on the real process of ketogenesis and how your body switches from using sugar to burning its fat for fuel, and how switching that on turns your body into a 24/7 fat burning machine. And I would say that if whatever health goals you have, if it's to get off the high blood pressure medicine, to get off the diabetes medicine, to lose the fat around your waist and on your body that you've been trying to get rid of for the past 15 years, you can do all that with the right education, the right tools. And my book is written in an easy to read way that will teach you everything you need to know to achieve your goals.
And where can people find this book at, Doc?
It's on Amazon. You can get it audiobook, which is cool, but you want to get the ebook or the printed version so you can see the guides, see the pictures, see everything that's been laid out for you, so you can follow follow the roadmap more easily. That's going to be available in hardback, paperback, or ebook on Amazon.com.
Cool, and we'll leave the link in the description, so they can just click the link and go to Amazon and get it if they want. So we appreciate time with us. Your time is precious. But we appreciate the knowledge because, it's a conversation to be had. And I don't think, I think with the Epstein stuff, people are kind of going past, this healthcare, the issue didn't get resolved and we got to solve it. So
definitely.
I'm going to leave y'all with that.
It's great being on with y'all. Definitely. We didn't get to talk a whole lot about the shutdown and how it didn't really help advance our healthcare needs. But they're going to bring that fight back up in the next few weeks, so we'll have time to talk about it.
Yeah, we'll have you back on, Doc. Definitely.
Yeah, and thank you as always for hopping on. Thank you for being a friend, and I value your advice and appreciate you, brother. Thank you.
All right, guys, I appreciate you. Take care.
Bye bye.